Something happened in Nicosia, here where I reside, and it is something tragic. However, there are a lot of lessons I think we can learn from what happened. Let me just read a couple of things, a couple of reports. Let me read this one is from Filet News. And of course, there are a lot of news outlets that capture what really happened. Five nursing staffs at a hospital in Nicosia has been placed under detention after a 20-year-old infant died following alleged administration of baby formula mixed with ethyl alcohol. The staff members, that's the nursing staff members, appeared in court and were facing charges of causing death by negligence. The investigation revealed that ethyl alcohol was accidentally mixed into baby formula due to negligence and failure to take proper precaution. There are other babies affected. 6 other infants were also affected by the contaminated formula, but gladly all the 6 babies remain in intensive care units and were in stable condition, and their recovery has been reported to be progressing positively. Now, there's so much that needs to be talked about. Recently, I was in a lab session with some of my medical students, and I was encouraging them to pay attention to what I was saying and what I was trying to explain. Particularly, most times when you are explaining lab procedures and some safety rules in the lab, students don't normally pay attention to what you're saying because it looks simple. It looks simple. And I was telling them there are a number of things they need to pay attention. The lab procedure could look simple. For example, don't come into the lab eating, don't come into the lab with your phones, meaning that you need to put them in a silent or switch it off. Maybe the lab session is just about an hour or thereabout. That's sufficient to put your phones away. But somehow, because we're connected to our phones and is visibly, it's the reality with young people. So they are not able to endure even an hour without their phone. So this kind of thing can divide their attention. So you are in the middle of an experiment and then you have an alert or something coming in your phone or a notification, and you want to just quickly check. Before you know, you missed a lot of detail and you can easily make mistake. And there are a number of things also that I have communicated to students to pay attention, that you have to pay attention to labeling, because you don't want to mix certain things that ought not to be mixed. So you have to pay attention to what you are working with. The bottles ought to be labeled correctly. As so many of these lab safety rules, some of them look at it as if it's simple, but this is where we are getting into. So when you've not learned to be attentive, you've not learned to be careful when you're working, that thing, you drag it into the workspace tomorrow. And that's what we don't want. And I've told them I don't want to see any of them in prison. But there's some few things I want to mention, especially to medical people, to medical persons, especially the younger ones. For my medical students, for those in nursing, and those who are responsible to ensure our healthcare system is working well, you have to know that you're not just studying a course. When you're studying medicine, when you're studying nursing, it's not just a course you're studying. You are actually carrying a responsibility that is very crucial. So when you are studying maybe about the drug process, you are studying about procedures on how things are supposed to be done. You are studying how to take decisions. You are studying how uh, to do whatever that you are supposed to do to ensure tomorrow you become a successful healthcare professional. What you are actually doing, you are doing something that require attention. I mean, undivided attention. So you have to understand that any mistake you will do will definitely affect a life. So at the end of whatever you're doing is a human life. So, and you have to understand that you are carrying a responsibility, you are carrying a trust. So when patients come to you, they will be trusting you with their bodies, they will be trusting you even with their hopes. They will be trusting you, or some of them will come with their family members, their children. They are trusting you. So you must understand that it is a trust. And therefore, that trust will demand attention, that trust demands discipline, that trust demands so much from you. So it is important that you understand some of these things I have been mentioning. It demands you to value the trust that people are putting in you. So if you are careless with drugs, if you are careless with prescription, if you are careless with procedure, you are not just making a mistake. You are truly not making a mistake. You are actually making a gambling. You are gambling with your life. You are really gambling with your life. So if you really want to help people, you have to be attentive. I don't know the details of really what has happened here, but preliminary investigation have shown that the major thing there is negligence. And of course, mistakes can come from different things. Sometimes you are tired, sometimes you are overworked, sometimes. And that's why those little precautions you put here and there are supposed to help you to cut to the barest minimum, if not all, you understand, uh, um, tendencies to actually make mistakes, because knowing that any mistake you will do at the end of it is a life that will be taken. So I want you to know that you're here to save lives. You're not here to destroy them. I want you to know that you are here to bring progress into society. And I want you to remain in the clinics. I don't want you to end in prisons. I want you to remain actually representing your family. I want you to represent your society. I want you to represent the goodness, you understand, of humanity. And that's what we are. Most times I told them, each time you wear this white in the lab, white coat or lab coat in the lab, it should represent, you understand, duty. It should represent healing. It should represent healing, not that at the end of the day is a pathway through which you get yourself into prison. We don't want this. We want you to stay there because we love you. You have been in the forefront to helping us in many things. So as you go through your training, if you're a student, yes, if you're a student, if you are a young professional also, as you go through mentoring and all that, you need to pay attention. You don't want to entertain any carelessness here and there. And that's why you need your attention in whatever you are doing. And my desire is that tomorrow I see you, I will celebrate you. I told most times I tell my students, I want you to be the one to treat me, not that I'll be afraid when you are graduating. I don't even want to see you at all. And of course, as I said, I love you. So even if I heard that you're in the prison, I'm likely to visit you and to remind you what I've been saying to you, that I don't want you to be in the prison. I want you to be saving life. These are some of the few points I wanted to make in regards to what really has happened. Is a tragedy, and I don't want to hear this news. I want to hear news of breakthrough. I want to hear news of how lives are saved, how lives are are helped every day. Even if we were going to lose a life, let it be shown that there are worthy efforts that the personnel have put. I want to hear that even if we lose anyone in the hospital, but that the effort that you have committed and put is not worthy. Not that at the end of the day that the death was caused by a negligence. We wouldn't want to hear this. So I wish you the best, and I wish you the best in your career and in whatever good endeavors you're doing.